Welcome to Easy Medicine. In this video, we will review 11 clinical cases focused on normal development, adolescent behavior, cognitive assessment, and defense mechanisms. Listen carefully to each scenario, consider the question, and then review the correct answer with its explanation. Let us begin with the first case. Case 1. A 3-year-old boy is brought to the office by his parents because of behavioral difficulties. His mother says, he is physically healthy and affectionate, but he has become more defiant and often resists our instructions about getting ready for bed. He plays roughly with his 6-year-old brother and throws tantrums when he has to share his toys or put them away. His preschool teacher describes him as an active child, who sometimes talks out loud to classmates while the teacher is speaking. He is easily distracted and often gets up to walk around the classroom. The patient can draw circles, speak in 3-word sentences, go upstairs with alternating feet, and use the toilet, but he cannot wipe himself. His parents are concerned that he cannot dress himself and that he wets the bed approximately twice a week. The physical examination is unremarkable. Which of the following is the most likely explanation for this child's behavior? The correct answer is normal development. This boy's behavior is most consistent with age-appropriate behavior. His motor, language, and social skills are within the normal range for a 3-year-old. A short attention span, increased motor activity, such as difficulty remaining seated, occasional impulsivity, such as speaking out of turn or having tantrums when toys are taken away, and oppositional behavior at bedtime are consistent with normal developmental variation in young children. Case 2. A 14-year-old boy is brought to the office by his mother for a 6-month asthma checkup. Although his asthma is generally well controlled with long-acting agents, he has episodes of exercise-induced bronchoconstriction for which he was prescribed a short-acting beta agonist. His mother became concerned after the physical education teacher called from school and said that her son was refusing to participate in class. When asked about this, the patient said that it was easier to avoid exercising than to use an inhaler at school. His family history is significant for chronic obstructive pulmonary disease in his maternal grandfather, heart disease in his father, and generalized anxiety disorder in his mother. His vital signs and physical examination are within normal limits. Which of the following factors would most likely increase this patient's adherence to bronchodilator administration? The correct answer is seeing peers use asthma inhalers at school. Adolescence involves the developmental tasks of separating from parental figures and finding one's own place in society, which includes beginning to take responsibility for one's physical health. This exploration is often accompanied by rebelling, pushing limits, and a strong need to fit in with a peer group. All of these factors can contribute to low treatment adherence rates. In particular, adolescents with chronic medical conditions may hide their illness because they feel self-conscious and different from their peers. Factors associated with better treatment adherence include having close peers with complementary behavioral practices, positive family functioning, school involvement, physician empathy, and immediate benefits from treatment. Another factor affecting adolescent treatment adherence is that the prefrontal cortex, the center of executive function, does not fully develop until the 3rd decade of life. Compared with adults, adolescents are less able to weigh the risks and benefits of their decisions or anticipate that negative consequences may occur. Case 3. An 11-month-old boy is brought to the office by his mother for a well child visit. His mother reports that he cries and screams when other people approach him. She is concerned because this has been occurring for the past few months and seems to be worsening. She says, "He used to love being held by everyone, but now he wants to be only with me. He will not even let his grandmother hold him anymore." The patient is crawling and can stand only with assistance. He babbles but does not say any clear words, and he uses hand gestures to communicate. His growth curves are tracking adequately. During the physical examination, the patient clings to his mother and begins crying and turning his head away when the physician attempts to interact with him. Which of the following is the most likely explanation for this patient's behavior? The correct answer is normal development. This patient's distress when interacting with unfamiliar people is typical of stranger anxiety, a normal part of development that begins at approximately 6 months of age. It is characterized by distress, expressed through crying, screaming, or clinging, when unfamiliar people approach, even when the caregiver is present. The development of stranger anxiety at this age indicates that the infant has formed a specific attachment to the primary caregiver, his mother, and can distinguish her from an unfamiliar or less familiar person. Stranger anxiety typically peaks at approximately 9 months of age and resolves on its own by 2 years of age. Case 4. A 72-year-old woman is admitted to the hospital because of abnormal vaginal bleeding. Uterine cancer is diagnosed, and the patient is scheduled for a hysterectomy. Following successful surgery, she compliments her surgeon and exclaims that she is a brilliant doctor who saved my life. After an uneventful recovery, the patient is ready to return home. On the day of discharge, a nurse informs her that the surgeon is running late because of an emergency. The patient responds angrily that the surgeon is terrible and does not care about patients. Which of the following is the most likely explanation for this patient's behavior? The correct answer is splitting. Defense mechanisms are unconscious ways of responding and adapting to situations in order to minimize anxiety and promote self-preservation. Splitting is a defense mechanism in which the self or other people are experienced in extremes, as either entirely positive or entirely negative. This allows bad qualities to remain completely separated from good qualities. Although splitting provides a less complicated way of viewing people and situations, it prevents positive and negative qualities from being integrated into a cohesive whole, which results in unpredictable fluctuations between the two extremes. In this situation, the patient initially idealizes the surgeon but later characterizes her as the opposite extreme when she becomes frustrated and disappointed that the surgeon is running late. Splitting is commonly seen in borderline personality disorder and can contribute to the unstable relationships and mood instability that characterize this disorder. Case 5. A 67-year-old woman comes to the office because of difficulty concentrating. She reports repeatedly reading the same page because she is unable to focus. She also describes memory problems and says that it takes a while to remember another person's name. Her medical history is significant for hypertension and type 2 diabetes mellitus. Both are well controlled through diet, exercise, and oral medications. She lives alone and describes her mood as good. Her blood pressure is 127/67 millimeters of mercury, and her pulse is 65 per minute. The physician decides to administer a brief cognitive test to assess her difficulty concentrating. Which of the following elements of cognitive testing would best assess impaired attention and concentration in this patient? The correct answer is reciting the months of the year backward. Several quick clinical tests can assess attention and concentration when these abilities may be impaired, such as in dementia, delirium, head injury, or depression. These tests include counting down from 100 by intervals of 3 or 7, reciting the months of the year in reverse order, or spelling the word world backward. Asking a patient to recite the months of the year backward is often helpful when the patient has a low educational level or is hesitant to perform a task involving mathematics or spelling. Attention and concentration are assessed in the Montreal Cognitive Assessment, a widely used screening tool for cognitive impairment. This assessment also measures orientation to time and place, executive function, language, visual spatial ability, and memory registration and recall. Results must be interpreted in light of the patient's educational level and any existing language, motor, or visual impairments. To diagnose dementia, the patient must demonstrate impairment in at least one cognitive domain, such as memory, language, or executive function, during testing, as well as functional impairment in activities of daily living, such as bathing, shopping, or cooking. Case 6. A 54-year-old man arrives for an appointment with a new physician. At the front desk, the receptionist tells him that the physician is running behind schedule and gives him several forms to complete regarding his personal and family medical history. The patient politely agrees to complete the forms and sits in the waiting area. However, when the physician reviews the paperwork, it contains only the patient's signature. The patient says, "I am sure a doctor with your education can take a good history." When asked whether anything is wrong, he says, "Oh, nothing. I am fine." Which of the following best describes this patient's behavior? The correct answer is passive aggression. This patient's indirect expression of anger about having to wait for the physician is an example of passive aggression. Rather than directly expressing his feelings, he agrees to complete the forms and then resists performing the expected task. Other behaviors used to indirectly express or diffuse hostile feelings include procrastination, forgetfulness, and purposeful inefficiency. Backhanded compliments, sarcasm, and denial of being angry are also characteristic of passive-aggressive behavior. Case 7. A 13-year-old girl is brought to the office for a routine visit. Although she is doing well in school and has friends, her mother is concerned about a change in her behavior over the past several months. They previously enjoyed spending time together, but the patient is now frequently moody and spends most of her time on the computer in her locked bedroom. Her mother also observes that her daughter becomes upset for no apparent reason and has occasionally used swear words. When her mother recently complimented her party outfit, the girl screamed, "I look hideous, and I am not going," and stormed out of the room. Later that day, she seemed fine and went to the party. During the examination, the patient is pleasant and cooperative but makes little eye contact and asks whether she can keep her tank top on. Which of the following is the most likely explanation for this girl's behavior? The correct answer is normal adolescent behavior. This patient's intense self-consciousness, concern about appearance and social acceptance, moodiness, increasing need for privacy, and transient emotional outbursts are characteristic of normal adolescence. Adolescence involves the developmental tasks of separating from the family, developing a sense of identity, and adjusting to the hormonal and physical changes of puberty. This girl's reluctance to remove her tank top for the physical examination is likely related to self-consciousness about pubertal development. Although distinguishing normal adolescent behavior from early signs of psychiatric disorders can be difficult, her engagement with school and friends is reassuring. In contrast, adolescents with persistent anger, sadness, impulsivity, sleep or appetite disturbance, declining academic performance, or social isolation from peers require further evaluation. Case 8. A medical student has just finished the United States Medical Licensing Examination, Step 1, and is anxious about her performance. She becomes especially unnerved when other students discuss the difficulty of the examination and compare their answers to certain questions. The student decides not to think about the examination until her score arrives because worrying is not going to change the result. She is delighted when she receives a very high score several weeks later. Before receiving the result, which of the following defense mechanisms did the student exhibit? The correct answer is suppression. Defense mechanisms protect individuals from awareness of uncomfortable feelings and can be classified as immature or mature. Immature defense mechanisms, including denial, acting out, regression, and splitting, are maladaptive and are generally seen in children and in psychopathologic states. Mature defense mechanisms, including altruism, sublimation, suppression, and humor, are used more often by adults and allow a healthy, adaptive response to emotional distress. This student uses suppression to alleviate anxiety about her examination results. She is aware of her discomfort but decides not to focus on it. Suppression is a mature defense mechanism in which an individual intentionally sets aside unpleasant thoughts or feelings to cope more effectively with the present reality. Case 9. A 42-year-old man comes to the office for a checkup. He has no medical symptoms but says, "I am just feeling stressed and not like myself." The patient is going through a contentious divorce. He is outraged that his wife is seeking full custody of their children and says, "I cannot believe she is doing this to me." His work as a legal researcher had been a welcome distraction from his upsetting personal life until yesterday, when he was called to his supervisor's office for yelling at the receptionist after the copy machine ran out of ink. Which of the following is the best explanation for this patient's behavior toward the receptionist? The correct answer is displacement. This patient's redirection of anger from his wife to the receptionist is an example of the defense mechanism displacement. In displacement, emotions are unconsciously transferred from their actual target to another person or object that is less threatening. In this case, the patient is angry with his wife but cannot express that anger directly because doing so may affect the child custody proceedings. Instead, he unconsciously transfers the emotion to the receptionist, which results in an angry outburst over a minor incident. Case 10. A 5-year-old boy is brought to the office by his parents for a well child visit. His mother says, "My son is doing very well. He can read at a first-grade level and knows his name and address. He loves to sing, dance, and play house with his older sisters. Everything seems fine with him. We just want to make sure his vaccinations are up to date before our family trip overseas." The physician administers the appropriate vaccinations. Just before leaving, the father says, "I think you should know that my son plays with his sister's dolls and does not seem to like cars or trucks like most other boys. Is that normal?" Which of the following is the most appropriate response to the father's concern? The correct response is, "I hear your concern. Let me reassure you that many boys play with dolls as a normal part of exploring the world." Gender is the innate sense a person has of being male, female, or a combination of both. Children develop an understanding of the concept of gender by 3 to 4 years of age and develop a sense of the permanence of gender at approximately 5 to 6 years of age. It is developmentally normal for children to explore the world by participating in activities that may be culturally associated with another gender. It is important to follow the child's lead and allow this exploration to occur. In contrast to occasional play and exploration, a prolonged and intense feeling that a person's gender does not match the sex assigned at birth is more likely to continue into puberty. When this feeling is associated with significant distress, it is diagnosed as gender dysphoria. Patients with this condition have increased rates of psychiatric illness, including depression and anxiety, and require monitoring and support. Case 11. A 3-year-old boy is brought to the office for a well child visit. His mother reports that apart from an ear infection last year, he is in good health. The child started preschool this year. He plays alongside other children and often copies what they are doing, but he does not play cooperatively with them. The patient knows his age and gender and speaks in 3-word sentences. He can ride a tricycle. He cannot use a spoon or fork but enjoys eating with his hands. He scribbles spontaneously but cannot copy a circle. He weighs 14.5 kilograms or 32 pounds, and is 96.5 centimeters, or 3 feet 2 inches, tall. His head circumference is 50.8 centimeters, or 20 inches. Which of the following developmental milestones is most likely delayed in this patient? The correct answer is fine motor development. Developmental milestones during toddlerhood must be thoroughly assessed by practitioners during routine well child examinations. Milestones are divided into categories that include cognitive and academic abilities, gross motor control, fine motor control, social behavior, and language. Because every child is different, Milestones should be used as guidelines. For example, one child may be able to kick a ball at 18 months, while another may do so at 24 months. A child who is deficient in a single task is unlikely to have a developmental delay, but failure to reach several milestones by the appropriate age, or a marked delay in one area, requires further evaluation. 3-year-old children should have the fine motor skills needed to copy a circle and use utensils. This patient has not reached the expected fine motor milestones and should undergo additional evaluation. This concludes our review of 11 clinical cases involving childhood and adolescent development, cognitive testing, gender exploration, and defense mechanisms. Thank you for studying with Easy Medicine. If this review was helpful, continue practicing with the other clinical case videos available on the channel. See you in the next lesson.